This Heart Health Month, we've talked about causes of heart disease, symptoms to watch for, and risk factors. Today, we're switching to talk a little bit more about prevention. We're joined again this morning by Dr. Mohammed Osman, cardiologist with Mayo Clinic Health System. Good morning.
Good morning, Alexandra.
Thanks for being with us again.
I'm happy to be back.
So we know that diet plays such a big role in our heart health. Can you tell us why that is?
Well, diet directly affects the different concentration of different, nutrients within our blood. The big ones are cholesterol, salt, sugars. All of these have direct effect on our heart health. For example, cholesterol. If you eat a lot of, a diet which has a lot of cholesterol contents, cholesterol will tend to deposit on the long term in the arteries. And this can happen in any form of arteries to the brain, arteries to the heart, or arteries to the legs.
Okay, and so we hear about a lot, avoiding high fat foods, avoiding fried foods, but are there any foods that we can eat that will help our heart health?
Definitely, I always talk to my patients, about healthy diet habits. I usually recommend, at least, half of your plate to be including some vegetables, some, salads, overall have some, colorful salads and vegetables in your plate. Other foods like lean protein are actually good for the heart. Whole grain are also good for your heart. Try to avoid fried food, processed food, adding sugar, adding salts. These are the things that on the long term will affect your heart health.
Okay. And so over time, sleep problems can also hurt our hearts. As many as 1 in 2 adults experience short-term insomnia. So first, what is that heart health sleep link? Just explain that for us.
Well, that's a very interesting, question, because not a lot of patients think about that. Not a lot of people think about that. There's actually both direct and indirect link between sleep and heart health. Definitely, lack of sleep, or I would say lack of a quality sleep, can directly put a stress on your heart. But also indirectly, lack of sleep will actually augment these unhealthy habits, like, eating unhealthy, binge fooding, or basically some smoking, because that helps some people to cope with stress, So directly and indirectly, lack of quality sleep affect your health.
Okay, yeah, so you may think a midnight snack is going to help you, but in the long run, probably not.
Oh, definitely
probably
not
a
in
good
the long
idea.
term, yeah.
And what about a few other things people can do to keep our hearts healthy? What would you recommend?
I would say, exercise, regular exercise have been shown by several studies to help your heart health on the long term. And the usual recommendation from the guidelines is to try to incorporate about 30 minutes of cardiac exercise a day for a total of about 150 minutes a week. That will help your heart on the long term. Other things, like especially for patients with diabetes and high blood pressure, we need to get these under control. Having diabetes is not the end of the world, but you need to control diabetes and know how to live with it, on the long term. Same apply for high blood pressure.
Any screenings that people should be talking to their doctors about, or that you recommend, and what kind of qualities makes you think that someone should get screened?
I think for adults, at age around 20, they should at least talk to their doctor at one point about, checking their cholesterol, checking their blood pressure, and checking their sugar. And that apply for sure among patients who have family history of either diabetes or high blood pressure. These should get screened.
Okay, great to know there. And then lastly, when should someone seek care when it comes to their heart? Is the younger better, or should you wait till you're displaying some of these symptoms?
Oh, younger is definitely better, and I always talk to my young patient about preventing, Prevention is always better than cure. So if we start early on, we can actually detect early signs of heart disease, try to prevent, progression of the heart disease. So I would say early is always better.
Okay, great. Easier to treat the earlier you catch some of these symptoms too?
Definitely. When we catch these diseases at early stage, it's definitely easier to treat, and it will help us actually to prevent, impact on the life of the patient and on the quality of life of these patients, because once they get into the late stage, it may be tricky or difficult to cure and reverse the process.
Okay, all right, very important there. Well, Dr. Osman, thank you so much for joining us again.
Thank you for having me.